A bit longer on health because the Battor Catholic Hospital in the North Town District is battling serious infrastructure, equipment and staff shortages despite performing hundreds of life-saving surgeries and attending to thousands of patients every day. According to hospital authorities, the situation is putting enormous pressure on doctors and nurses, which is affecting quality healthcare delivery.
The Battor Catholic Hospital in the North Town District remains one of the busiest health facilities in the Volta region. The hospital provides health care services to residents within the district and also receives patients from other regions of Ghana and neighboring Togo. However, despite its critical role in healthcare delivery, the hospital is currently facing serious infrastructure and equipment challenges. At the hospital's theatre unit, where critical surgeries are performed, doctors are struggling with limited operating space. Health workers say that after each surgery, patients must first be transferred to another room before the next operation can begin because the theatre space is inadequate. Gifty Dompre is in charge of the surgical department at the Battor Catholic Hospital.
Our spaces are not enough. It's not big for us. Looking at the number of cases we do here, January, February alone, we have done 521 surgeries. Catholic Hospital Battor. We do a lot. We don't have a lot of spaces. So we are pleading that they should come to our aid.
Another major concern is the neonatal intensive care unit. The 3 unit currently has only 3 functioning incubators, although the hospital requires between 7 and 10 incubators to properly care for premature and critically ill babies. Dr. Dorothy Saki says the shortage is affecting their inability to provide the best care for newborns.
As we know, our health sector needs more work, more equipment. So that's not the only thing that we need. We need what we call the TCB, or that's a transcutaneous venometer. That's for checking a level of bilirubin in a baby who is jaundiced. It will really help us because we are also limited. Sometimes when you take the blood sample to the lab, we don't get the results within 24 hours. It can take about 2 or 3 days.
The children's ward is also heavily congested, with limited space for patients and caregivers. Pregnant women who attend antenatal services at the hospital also face overcrowded conditions due to inadequate space. At the delivery ward, health workers say the lack of modern equipment and space continues to pose serious challenges to maternal and newborn health. Records from the outpatient department indicate that the hospital receives between 1,000 and 2,000 patients every day, making it one of the busiest health facilities in the region. However, hospital authorities say some departments are severely understaffed.
It's really stressful to work in this way. There are instances that the patients are more than the beds we have. And even the nurses, the number is less. We can have only 2 nurses on duty in the labor ward.
Forcing health workers to work extremely long hours. In some cases, staff are required to work continuous shifts of up to 24 hours in order to meet the growing healthcare demands. Management is therefore appealing to the Ministry of Health to grant clearance for trained nurses who have completed school but are yet to be employed to help address the staff shortage.
When you look at our statistics from last year, that is 2025, we saw about 76,000 patients on outpatient basis. Out of that, we admitted over 11,000 patients. About half of these patients are pregnant women who, for one reason or another, needed to be admitted.
Health workers warn that without urgent intervention, the increasing demand for healthcare services could overwhelm the facility and affect the quality of care provided to thousands of patients who rely on the hospital.